My experience at UT Southwestern was wonderful, and I'd do it all over again if I had that option. I believe that UT Southwestern did an excellent job preparing me and my peers for residency because it offered such a rigorous and rich and diverse clinical experience. So far, my favorite thing about being a resident at UT Southwestern is having that real responsibility.
Out in the hallway.
For the rotation that I'm on right now, I'm at the VA hospital on the inpatient psychiatry unit. A day in the life of a psychiatry resident is quite different, actually, depending on the rotation we're in. We do 4 months of medicine, 2 months of neurology, 6 months of various kinds of psychiatry. So there's always something new, fresh, and exciting.
Hi, my name's Bernadette Peltier, and I just finished applying for a general surgery residency position. My question is, how was the transition to being referred to as doctor and having new big responsibilities on the team? And I'd love any advice that you might have on making that transition as smooth as possible.
So the transition between being med student Vincent and Dr. Li it was terrifying at first. Due to COVID. I hadn't seen a patient since October of 2019. I think was my last time seeing a patient before July 1st, 2020, first day of intern year. And UT Southwestern did a great job preparing me for residency, so it felt pretty natural just a couple of weeks in. As for advice on how to transition, I would just say, just do your best in med school. Take the time to absorb as much as you can, do as much as you can, and then chill, take a break before residency. You're gonna appreciate the fact that you did that because that knowledge and skill, it'll come back to you, even if you took a huge months-long break from clinical work like I did. If I could describe my intern year so far in one word, I would use the word growth. Because this intern year, it's all about the growth from medical student to doctor, right? From someone who's always dependent on the resident or the attending to the resident, right? Who is growing in independence and growing in the ability to care for patients. So I think this has been a huge season of growth.